Hi, I'm Ian Prangley. I'm a physiotherapist at Marylebone Health Group Clinic, and I'm going to talk about rotator cuff tendinopathy. Rotator cuff tendinopathy is a problem with the rotator cuff tendon or tendons. The rotator cuff they're four small muscles that are very close to the shoulder joint, and they help to produce rotation, but also provide stability within the shoulder joint. Occasionally these tendons can get overloaded, particularly if some people have poor strength around the area, and that is when the tendon can become reactive and result in pain. Typically what we would find is that someone will have pain with activities that are overhead, so that might be lifting their arm above their head, putting on a jacket, putting on a jumper, and particularly if they are trying to compete or play in overhead sports such as tennis, they will have pain on their serve. When I see people presenting with rotator cuff tendinopathy, they'll obviously describe the symptoms similar to that in terms of pain overhead. What I would typically do is look at things such as the positioning of their shoulder blade, how well they're able to control their shoulder blade, because that provides a foundation for which the shoulder can move overhead. So typically there will be often weakness of muscles that upwardly rotate the shoulder, and they will often have strength deficits within the rotator cuff, and particularly the posterior rotator cuff. So that's the muscle and tendon at the back of the shoulder. So once the diagnosis, have a clear diagnosis that it is rotator cuff tendinopathy, the primary treatment is exercise therapy, and it would be graduated strengthening exercises for the rotator cuff muscles and also the muscles that control the shoulder, the shoulder blade, and particularly the upward rotators of the shoulder blade. So this period of exercise therapy can take a number of weeks and sometimes months in order to get the shoulder back to being pain-free and the tendon to be healthy again. If someone is trying to return to an overhead sport such as tennis, as well as strengthening the shoulder blade muscles and the rotator cuff, there needs to be a gradual progression back to the sport. So this would include doing exercises that are more dynamic, which could be throwing, and then gradually increasing the intensity of serving until they're able to compete and play sport at the level that they were before.